New information about the Omicron COVID variant spreading rapidly across the country. In the last 3 days, more than 671,000 new cases have been reported in the U.S., and it could be weeks before the numbers start to fall. But there is some potential good news. A new pill has been authorized to treat COVID in the U.S. Nancy Chen has details on that and why hospitalizations have not increased sharply so far. Nancy, good morning.
Nate, good morning to you. New research from several universities overseas shows that Omicron cases tend to be less severe, but health officials are still anticipating a spike in hospitalizations. Across the country, several hospitals are already overwhelmed, and in the New York area, nearly 20 urgent cares temporarily closed yesterday because of staffing issues.
The sheer number of infection will cause an overwhelming for most of our hospitals.
Some hospitals are already there. The ICU in Michigan's Beaumont-Dearborn Hospital is at 98% capacity. The coronavirus accounts for most of those cases.
What is the fear of what could happen?
It's really the unknown. We are in a perfect storm.
Mary Ellen Coaches-Roulard is the chief nursing officer. She's now working alongside a team of U.S. military members sent by the government to help with staffing. One thing health officials say could help hospital staffing shortages: shortened isolation times after exposure.
If you are vaccinated and if you are boosted and you get infected, the virus may not be staying with you for a longer time, for 10 days, and we need you to come back to work.
3 federal officials tell CBS News the CDC will likely issue new guidance for healthcare workers about isolating after testing positive, potentially lowering the amount of time required to 5 to 7 days instead of 10 days. That guidance may ultimately be expanded to a larger audience.
We got good news today.
In a major milestone in the fight against COVID on Wednesday, the FDA authorized the first antiviral at-home pill to treat the virus. The agency found Pfizer's 5-day series of 30 pills significantly reduced the risk of hospitalization for those at risk of serious illness.
It almost certainly will be a physician writing a prescription for someone who within the first 3 days of notable symptoms of COVID and is in a high-risk group to get it.
Now, the White House does warn those antiviral pills won't be widely available for months, and that the pills are not a substitute for the vaccine. They only help after getting coronavirus. But with just 2 days left until Christmas, Gayle, health officials are reminding everyone to take those precautions, including wearing masks and getting tested.
And we can all do that. Nancy, thank you very much.